Hello, my name is Dr. Cheryl Burdett, and I'm the clinical director of Origins Incubator. And today we looked at some of the nuances around stool testing. And one of the things we delved into is what should we do when we order a stool test because we feel that this might be the reason for a patient's symptoms such as abdominal pain, constipation, bloating. And what we get back is something that shows no pathogens, no bacteria, pathogenic bacteria present, but an imbalance of commensal flora. How meaningful is that to us? And so we've all seen this issue. Maybe we have somebody who's highly symptomatic, or for sure there's going to be a big bad pathogen that comes back. And when we order the test, what we actually see is there's the absence of a pathogen, but some flora that can be normal, but might be overgrowing. And how associated is this with pathology? Could it be responsible for significant symptoms, even though it's an imbalance of relatively normal flora? And the answer to that can be a yes. And the reason for that is because it's not always about just the bacteria itself, but what it produces. And when we see an overgrowth of imbalanced flora, it's often gram-negative bacteria. It's often producers of lipopolysaccharides. And even if you're not that bad of a bacteria, but you are overgrowing, now there's too much LPS. And that lipopolysaccharide, as we know, is of course a toxin, a metabolic toxin responsible for metabolic endotoxemia, can damage lipids and be the reason they're oxidized, can damage the heart and be the reason that there's damage there, can damage insulin receptors and contribute to insulin resistance. So absolutely can be a reason for pathology. And of course, another big player that LPS plays a role is in terms of autoimmunity. It increases things like toll-like receptors so that the immune system is more inflamed. Those receptors can even be increased on the GI mucosa itself, making the mucosal lining even more reactive. In addition to that, those lipopolysaccharides can decrease the activity of Treg cells. Treg cells are the ones that put the immune system back in balance, and a hallmark of many autoimmune conditions is that these Treg functions are low. So we wrestled with questions like imbalance of normal bacteria or commensal flora and thought about which conditions it can have a greater impact in, guiding us to know when to prioritize it clinically.